the Social Care Bill. Now, Mark, who's following on from me, is the finance wizard, so I will not be touching on finance aspects, and nor would I anyway, in any event, given that as a lawyer, that's not my area. So, but what I do as a lawyer is very much work with what is the law around how care is paid for, and what are your rights if you are facing care or a loved one is facing care, and then what is the implication of these headlines we're all hearing about Boris Johnson and the Social Care Bill. Slight spoiler alert, it's not very exciting. It's not actually going to make a huge difference, but we'll touch upon that. So, as I say, as a lawyer, I look at the law. And so the law as it stands right now in England, it is different in the different nations. So you've got different levels of care payments and care thresholds in England, Wales, Scotland, and Northern Ireland. I'm going to talk about England today. Theory is the same across the other nations, but again, the figures today will only apply to England. So if you are in a hospital, and I think everybody understands this, then we have a cradle to grave NHS service, which is fantastic, and very grateful for that, as are we all, I'm sure. It means that if you're in hospital or you are receiving medical care, that you are very much being that care you're receiving is paid for by the NHS. So your board, your food, and the care is free. It's free at the point of delivery, and this is really important, and it will remain free at the point of delivery as long as you are under the care of the NHS. Where things get expensive, and and where care comes in and where care has to be paid for, is when you are no longer under the remit of the NHS, and it is in the field of social care. Now, NHS, social care are two very different things. So again, a lot of people find themselves in hospital, but they've gone in for a broken hip or in illness, and whilst they're in hospital, they're being treated, and all that care is free. Once they are out of that hospital setting and they still need care and support, then often the NHS isn't there to pay for that, and that's where the social care thresholds will come in. So if you or a loved one, anybody you know is in need of social care, then it is what they call means tested. And being means tested means that they will look at how much money you've got, and if you are over a certain amount of money, you will be paying your care fees in full. Currently, the threshold over which you have to pay for your care fees is 23,250. So if you have assets over that level, then you are paying for your care in full. It is only when your assets fall below 23,250 will the state help step in and support you, but you will still be required to make a contribution from any income, and you're deemed to have notional capital and notional income. It's only when the threshold falls to 14,250 does the state step in its entirety. So actually, if you have money and you're not under the care of the NHS, then that you will be using up your own assets and capital and income towards paying for that care. Mark is going to talk about this in much greater depth than myself. What I sit there and say is, okay, well, let's make sure that people understand what their legal rights are as to how those assets are taken into account. So there's a lot of headlines we all often hear from people and say, oh, I'm really worried I'm going to have to sell my home to pay for care. Well, let's analyze that slightly. So yes, if you own a property and you need care, then the value of that property may well be taken into account. If you're living at home and care is being brought in, then the value of the home is disregarded whilst you are at home. So the care payment will only be accruing against the care you're getting in, whether that's once a day, 4 times a day, whatever that is. The value of the property is disregarded. If you move into a care home, at this point, this is when the property may well come into the equation. So somebody who is married or has a dependent living at home who's over the age of 60, the value of the house will remain disregarded. It is still a roof over the head of the person who's left at home, as long as they fit these qualifying aspects, and therefore that value of the property is not taken into account. However, if I were to go into a care home and I was single and I had a house, then the value of that care home, so the value of my home, would be used towards paying for my care fees. Now, it would be my choice, or those who are assisting me, whether that property is sold or whether that property is rented out and therefore generates an income. Or for some people, and a lot of things, there is an option for the families, you can have what's called a deferred payment. So if there is a property that is of significant value to a family member, perhaps for sentimental reasons or other reasons, it is possible to apply for what's called a deferred payment. This means that the value of the care that is accruing can be attached to the value of the home. And when somebody dies, that then needs to be repaid, but the family can then themselves decide whether they want to take out a mortgage or a loan themselves, or use their own savings to pay that loan off. So selling your home isn't necessarily what has to happen. So it's a bit of a red herring at times to go, no, nobody has to sell their home. It just might be the most practical solution to needing to pay for care. Because what we need to remember is that whilst we have a cradle to grave NHS service, then the social care is very much based on the private care providers. Care providers, by and large, whether they are care homes or care companies coming in, are businesses, and they can set their rates and set their tariffs. They can set the rates and tariffs they want and they think is appropriate to cover the care costs. So if you've got a care home and then, you know, they have staff, they have overheads, they have wages, they can set the level of fees that they think is appropriate. Locally in the southwest of England, in Bristol, we're looking at roughly £1,000 a week for residential care and about £1,500 a week as a rule of thumb for nursing care. And now this cost covers all the accommodation, all the heating and lighting, and pays for the staff. Now, this is quite important, and this is where we're going to come on to talk about the social care bill in a moment. This is very important that people understand that there is a distinction between the accommodation and the cost of care. So care is expensive. £1,000 a week is quite a terrifying amount of money, and a lot of people find themselves, caring for relatives as unpaid carers. Now, that's great, but they are still carers. But if there isn't the ability or the desire to look after a loved one yourself, and you are bringing in support, there's going to be a bill. Now, as I say, Mark will talk more about that, how you make sure that money works for you and you get all that. So what I say is, well, let's make sure that we've ticked off all the things that you have available to you before we look at that. So things to think about that are really important is, one, if somebody is in a nursing home, and a nursing home is a home that has either has a registered nurse on site or has access to a registered nurse 24 hours a day, 7 days a week. Somebody who's in a nursing home may well qualify for something called NHS Continuing Healthcare Funding. Now, NHS Continuing Healthcare Funding is essentially somebody who has significant care needs. The primary reason for their care is because of their health, and they are in a care home setting. We don't have cottage hospitals anymore. We have great big hospitals like Southmead, which are sort of getting people patched up and out into the community, because that's where people want to be. NHS Continuing Healthcare Funding, however, can mean that people have the care paid for by the NHS, but in a community setting. It's not easy to get. It's quite hard to get people to talk about it, but it is definitely a thing that exists, and it's always worth having a conversation if you've got somebody who is going into care, whether the NHS Continuing Healthcare Funding has been discussed. If it hasn't been discussed, it needs to be discussed, and they will do an assessment whether this person is sufficiently ill, essentially, to receive their care for free under the remit of the NHS. It is possible to challenge these decisions. I've done it before. successfully, where we've had clients who've said, you know, sorry, this person isn't sufficiently unwell to warrant NHS funding, and we've said, don't agree with you, going to challenge that decision, and they've reversed that. They've reversed that decision. So that makes quite a significant difference to the assets available. So that's your sort of top level. If you, for whatever reason, however, are unable to or are not eligible for the NHS funding, as I say, it is means tested. But if somebody's in a nursing home, they should be receiving funded nursing care, which is a contribution to the care costs. It's not a huge amount, but it is there. It is a sum of money that is available to pay towards that care in a nursing home. Secondly, making sure that people get their benefits. There is an easy win, making sure that somebody's getting attendance allowance. Attendance allowance is not means tested, and it is paid to the person who needs that care and support. The lower level's about £55 a week, the higher level's about £80 a week. The important thing to remember is if somebody's receiving the lower level at home and goes into a care home, then they should be eligible for the higher rate because they need 24-hour care and support. But unless you ask for it, you don't get it automatically. The other things to think about is, you know, let's look at the way the properties, assets and property is structured. Is there somebody living at the property? Does the person who needs care own the property? Do they own half the property? Do they own, you know, do they have a share in a property? So there are lots of things that, you know, as a lawyer, I will want to look at with somebody who's facing a care journey and make sure that all those things are really properly structured. Now, to talk about the social care bill, which is obviously a slightly hot topic because, you know, care is expensive, care costs money, somebody has to pay for it. There's this headline, oh, there's only going to be, you know, you'll only ever have to pay £86,000 towards your care. Sounds lovely, doesn't it? You know, that's okay. I'll save my house. I'll hold on to my house, pass it down to my children, worked hard. £86,000, that's not so bad. Okay, so let's look a little bit more in detail about this. So we're still in early days of the legislation, and, you know, let's dig a little bit deeper under the headlines. So if you remember when I said at the beginning that it is care that costs the money, not the accommodation. So what this £86,000 cap relates to is the care that somebody is receiving. So the important thing to realize at this point is that to start this clock ticking, you have to get the local authority to do an assessment and say, okay, this person needs care. And this person needs care. And this care that they need is 2 hours a day, 4 hours a day, doesn't matter. They will assess what a care need is. Now, the local authority's definition of what a care need is and what you might consider a care need might be very different. So if the local authority says, done an assessment for Mrs. Jones needs care, she only needs an hour a day. And the family is saying, well, hang on, we reckon about 5 hours a day is more appropriate. It is only that 1 hour a day that the local authority has deemed as required is what is going to start counting towards the care cost. If you want to pay for an additional 4 hours, by all means, but don't think that's going to count towards care cost because that's not what you need. The other point being that it is care that costs money. So you're still having to pay heating, lighting, accommodation, what they call hotel costs. If you're at home, you're still paying that. You're still paying your maintenance, your overheads. If you're in a care home, you're still going to be paying care fees that include your heating, your lighting, your accommodation. And actually, what's the split? How much actually does care cost as opposed to how much the hotel costs are? This cap does not cover the hotel costs. So you can sit there and go, hang on, these costs actually only relate to care that I am deemed eligible to have. It's going to take quite a long time to get to £86,000 using that metric. It's not going to take you very long to spend £86,000 on accommodation costs. So it is sadly not the magic bullet that people were hoping for. And the headlines we've had recently is if the local authority is paying towards your care costs, that doesn't count towards the cap. It is only payments you are making from your own pocket when you have had that assessment from the local authority. If you're paying care costs because you want a bit more support from around the house, that doesn't count towards the care cost. The clock will only start ticking when you've had that assessment. So I'm afraid that in reality, not a lot is changing. Not a huge amount is changing. We're still going to be facing people with huge care costs. And there are certainly ways of looking at structuring assets and making sure that all the legal rights are in place, and understanding what your rights are and understanding what the law says and understanding what the legal obligations are of the local authority, of the NHS, are important. It's also important to remember that if you move into a care home, you are moving into a property and you are on a license. You are moving into a care home that probably is on a rolling monthly contract. Those care homes, if you can't afford to pay the fees, may well say, terribly sorry, you can't stay here anymore. I've seen it happen, sadly, where there wasn't enough money to keep somebody living in the care home and they had to move out. Now, understanding this is really important. So understanding what your rights are, what the care home can do, what the local authority should do, what the NHS should do, and all these aspects really need to be thought about, preferably earlier. Prevention is better than cure, and planning is definitely better than crisis management. And as a lawyer, this is what I do. I sit there and I talk to people and tell them what their rights are and where, if there are challenges needed, we will challenge. I often say that people will get very upset if the criminal law is disregarded in the same way as the social care law and and laws surrounding the NHS and their obligations are handled. And yet it is something that, goes under the radar quite a lot. And, myself and a lot of people I work with are very passionate about making sure that people do what they're told. So I, as a lawyer, will do all the legal stuff. And I will clear off, I will tick off and say, right, we've done this, we've done all the things I can do as a lawyer to say, we've put you in the best position, you and your loved ones, in the best position you can be, given that you're going to have care on the horizon. Now, people don't tend to want to go into care. People need to go into care because they are in a position where care is needed. They're ill, they're frail, they can't manage themselves. There will come a point, though, as a lawyer, when I'll go, well, I've done my bit. You're now in care and you're now having to pay for it. And at this point, my friend Mark will come along and tell you exactly how this works financially, and how you make that money work over the period. So really, I think at this point, from my point, don't just take things on face value. There is a lot going on behind the scenes with care, and regardless of these proposals, it's not going to have a huge impact on most people. This £86,000 care cap, sad as that is, it's still going to be something people need to think about. So Mark, over to you to do the numbers.
Hi, thanks, Hella. It's a very good point to come into. I'm just going to share my screen because, unlike Hella, I've got some slides to go through. So bear with me. Technology is not my strong point. So with a bit of luck, you should be able to see, can you see my screen, the first thing? And can you see a slide deck up? Excellent. Thumbs up, always a good thing when you get to this point. I'm Mark Stone. I'm a financial planner here at Tilney Financial Planning. We are part of the Tilney Smith & Williamson Group, there we go. I'm part of the Tilney Smith & Williamson Group. We are a large wealth manager who have been around for 180 years. We've got over 100,000 clients. We look after in excess of 40 billion of assets. We've got 265 qualified financial planners and 290 investment managers. So we think we've got kind of the expertise to help with the numbers, as Health puts it. We're all well qualified. As you can see there, we're proud of our expertise. Lots of our colleagues are, and including myself, are chartered financial planners, either by the Insurance Institute or the Chartered Insurance Institute for Securities and Investments. We've also got 17 colleagues who are part of the STEP, Society for Trusted Estate Practitioners qualifications, which is, again, they get heavily involved in things like care fees planning, etc., etc. So what do we do? How do we help our clients? We help people sort of plan for the inevitable and the possible, like dementia. And we would encourage people to make sure that they get the right paperwork in place. Health has already mentioned on at least one occasion around getting the legals in place. Our view is that's exactly what you should be doing. You should be looking at getting powers of attorney in place, both health and welfare. And if you haven't got someone to help do that for you, then again, we can put you in touch with someone like Health who will help do that. We want all of our clients to be fully aware of what they should be doing and when they should be doing it. We want to make sure that people plan for the end of their life as much as they plan for the rest of their lives. We all plan for the future. We all plan for the immediate future. Our view is, and Health again has already mentioned it, you should be planning for all eventualities. For some people, obviously that's not possible, but for a lot of people, it's making sure that you have the right pots of money in the right places, so that you can get the help you're looking for when you need it. Our role in all of this is we work with all of our clients to understand what the requirements are, understand what the circumstances and needs are. But then what we do is take the various scenarios that we put in place for them and run scenarios with them. With those scenarios, what we effectively do is make sure that our clients have informed decisions to agree any compromises in what they're looking to do. And that is really, really important when you're talking about sort of care fees planning, talking about making sure that people can stay in their own homes, etc. Because our aim is to provide effectively the best outcomes for our clients. What we aim to give our clients is the highest quality service. We can get the technology to work. Sorry about this, everybody. We will put together a personalised, robust financial plan, which includes what we call cash flow modelling. We will then proactively look at their ongoing investment requirements. We use our extensive in-house research to provide things like market updates so that you know how things are going. We provide 3 monthly valuations and online access through our Mighty Only portal, so you know how things are progressing, how they're going forward. We also then regularly review all of our clients' requirements. We do that in such a way that we make sure that the advice in place still meets and is suitable for what our clients want to do. And then we work with other professionals such as Health to make sure that the plans we put together for everybody are absolutely robust and are able to do what we need them to do when we need to do them. So the best way I think we can look at this is to look at a case study. But before we do that, Health has already covered this off for me. So what impact does the sort of social care bill have? Remember, as Health has already said, it's not yet on the statute books, so this is open to change. Again, Health has already highlighted there was a change sent out a couple of weeks ago discussing local authority payments for care. How does that impact? So what did the bill and the headlines actually say? And again, as Health has already highlighted, no one is going to pay more than £86,000 for their care. Fair enough. It also then says that there will be means tested benefits. So if you've got more than £20,000 and less than £100,000 of assets, there's some means tested benefits available to you. It's also said that everyone should get a care assessment to make sure that if they're between those two bands, that they get what they're looking for. But actually, is that the reality of it all? Well, again, Health has already highlighted it, so I'm almost sound like a broken record. No, it's not. The £86,000 is for care only. You still have to pay for the cost of your room. Health called it a hotel room. We look at it in the same way. The reason they've gone that way is to try and make it fair for those people who are having care at home rather than care in a home, that effectively, your care is taken care of, because their argument is, if you're at home, underlying costs of that home you have to pay anyway. So therefore, why is it any fairer if someone goes into a care home? They don't have to. I'll leave that open for kind of arguments, but again, it's not the magic bullet that we thought of. Again, as Helen has already mentioned, the means test at the moment is 20,250. You have a set in stone figure below which you get help, above which you don't. Whereas now we're into wider realms of £20,000 to £100,000. But this is the big, I suppose the kicker of all of this is that everyone should have a care assessment. Well, that list is long anyway. Finding the right people to help with that assessment is very difficult. And Health, I think, would agree that that list, or that length of list, is only going to get longer, because if there's not enough people already to carry out those assessments, then if there's more people needing it, it's going to take longer and longer to get there. And of course, there is the final part to all of this, which is brought out in the budget as well. Who's going to pay for all this? Well, for the tax year 2022-23, anyone who is earning will pay and pays national insurance will have an additional levy of 1.25%. Now, that additional levy is on both employers and employees, and of course, self-employed people. So as long as you're paying national insurance, you will have an extra levy for that one tax year. But from 2023-24 onwards, that levy is going to be an additional 1.25%, so 1.25%, but it's going to be taken from salary. The difference there is at the age of 65, you stop paying for national insurance. But if you're working, you could be any age and you still have to pay that levy through. So again, this is going to be a tax in someone's pocket, because it's going to mean you have less take-home pay. We all know that it has to be paid for, but that's the reason they made that change from national insurance to salary. Is there was the argument that the young were paying for the old. I don't subscribe to that, but that's the reason why they changed that from being away from earnings, or away from national insurance, through to earnings. So those of you who've seen me present before will have seen the case that I'm about to go through, but I think it's even more important now with the change that we've seen. The situation that we will find ourselves with this is that our client has been diagnosed with dementia. They have initial costs they've incurred improving the home and adapting for future use. The condition they have is managed with medication and some help from family. Again, this is linking back to something Health said within her presentation, with some part-time care at home. In latter years, the cost therefore increased significantly because the family can no longer cope, and care needs are managed professionally full-time. But the distinction is in this one is that our client remains at home to avoid distress and disruption. How we do this is effectively look at something called cash flow modelling. Cash flow modelling is our tool of planning out someone's future, but doing it, in this case, diagrammatically, to show the impacts of what happens with things like, in this case, a surplus and deficit of income over expenditure. The way we look at this is that where there's a red line, that's an effective cost. So as you can see, cost to adapt the home is the first big red line. Then the costs drop because of care at home from the age of 83 through to 89. At 89/90, Unfortunately, there's full-time care required, and then that shows the increase in the cash flow, so increase in outgoings that needs to be shown at that particular time. That's kind of one side of the coin. The other side of the coin then is how the projection of the accumulated wealth goes. So where the previous slide was an income expenditure graph, this is what your capital value. So taking the side that shows you around a care bill, if you've got more than £100,000, this is what your wealth would look like to pay for the ongoing care that you need. So as you can see, we start off on the left-hand side at the age of 83, and there's £450,000. Now, what we do with most of the cash flows that we look at, and the reason we link this back into care, is that we do disregard the value of the property initially for care. So this would be your liquid assets, investments, pensions, cash holdings that we're looking to use. So as you can see, from 83 onwards, there is a drop in care as we go along. But then once our client gets to 90, because they then need full-time care, and it goes back then to everything that Helen said around, when is care needed, how is it organised, what's the cost of that care? That's when we show the sharp decrease in assets. With the headlines that have come out from the recent social care announcement, you would expect to have seen, especially at the latter ages from 90 onwards, that graph stay fairly static because there's now a cap on care. But of course, it's not, because that cap is only on the care and not on the cost of staying at home. If we were to show this as someone in a care home, there may be a bigger increase in those initial bars because you're having to pay for that cost of care as you're ongoing. What we do as financial planners, and where we think we can benefit our clients, is both before, during, and after sort of care is required, is make sure that assets are managed in the right way, that income is paid from the right places in the most tax efficient manner, to try and prolong those assets for as long as possible. Within these graphs, we've used a conservative, an optimistic, with Helen saying £1,000 to £1,500 per week figure. We've used £50,000 as kind of the cost of care. Now, this fits in with this particular scenario because it is care at home. It's not care in a home. So that's why the graphs are going down sooner. And what we will aim to do is to make sure that our clients are in the most tax efficient environment they are, so that therefore tax doesn't play a huge amount for when income is being taken out. So how do we do that? We have a series of investment solutions because we are a full range of services provider. From the left-hand side, or as you look at the screen, we have our telephone advisory service that provides both financial advice and investment advice. Through to the right-hand side, which are what we call our full relationship managed solutions, where you have a financial planner and investment manager working together. And how we do that is we build in what's called our investment solutions. On this particular graph, you look at the right-hand side, we have a range of portfolios that you can run via our online Best Invest platform. That's there ready for those clients who feel confident that they can make their own investment decisions. But when you get closer to retirement, or indeed when you get closer to perhaps needing care, then you can start moving towards the left-hand side, which is going through initially our investment advisory service, which we will call a do it with you scenario. So Best Invest is do it yourself. The investment advisory service is a do it with you, whereby you sit with an investment manager, you discuss the range of investments that you can go into, and the investment advisor will ask you to say, right, okay, are you happy with the investment scenario? You have the final say. But then as you get further through, and again, possibly if powers of attorney are needed, you can then go into our do it for you scenarios, which is our core investment management service, or a personalized investment management service. The latter one is a more bespoke service where we will make all investment decisions for you. So we will be told this is the remit that we need to work to. We will then make all investment decisions for our clients to make sure they're in the best possible place, to make sure that those investment decisions are made. And I suppose finally, why would you choose us? Well, apart from everything I've just said, we have the wealth of expertise in doing what we do. We listen to our clients and we always put them at the centre of everything that we do. That slide says 24 billion of assets, but we've got 47 billion of assets. So we're well placed and have a huge amount of experience of providing investment solutions. Within our financial solutions, we offer tax-led structures, again, where we can make sure you're in the most tax-efficient way you can be. We offer specialist advice, and we will work with other financial professionals or other professionals such as Health or indeed accountants to make sure that our clients are in the best possible place to get the advice that they're looking for. But the one for me is with everything is we will give you transparent advice, and all of our clients will be at the centre of everything that we do. I just want to say thank you for listening to me. I thought mine was kind of the more boring part of the two, because Health could talk forever on her specialist subject. She's very, very good at it and very, very knowledgeable. I must come back in with the important information, which is nothing in this webinar is intended to constitute advice or a recommendation, and you should not take any investment decisions based on its content. The value of investments and the income derived from it can go down as well as up, and investors can get back less than the amount invested. Once again, thank you. And now I think it's time for questions, and I'll stop sharing screen.
Thank you, Mark. And thank you, Heleth, as well. Thank you for those excellent presentations.